Well, pharmacy access across Maine is dwindling, and now 45% of our state lives within a pharmacy desert.
So that means Mainers have to drive at least 15 minutes to get pharmaceutical care, and in rural Maine, that can mean an hour or more.
Yeah, the I-Team's Dan Lampariello has been closely investigating this crisis here in Maine and joins us now with more on his research with a focus on one town in western Maine. Dan.
Yeah, guys, I mean, that 45 number is what shocked me when we
Right.
started researching this. There's only 2 states ahead of us, and it shows that we're in good company when it comes to this issue. So many people across our state are in these pharmacy deserts. They have to drive more than 15 minutes or even more, which we'll get to access a pharmacy, whether that's retail or their local pharmacy. And that really impacts access to critical care for a lot of folks.
And I can't believe how many have been going out of business. I mean, we were talking about during commercial break.
Yeah.
Here where our station is, we used to have like 4 or 5 pharmacies right within.
We had
like,
a Rite Aid that was walking
distance
and a Walgreens, and both are now gone.
And a CVS too.
Yeah.
And then across the street an Osco at Shaw's.
Sure.
Yeah.
What made my jaw drop was hearing that there are some residents in Rangeley that are driving about 2 hours round trip. It's just unbelievable.
It's crazy to think about this. Rangeley is one of those pharmacy deserts. We have dozens across the state. They were just one example we wanted to try to focus in on. They have to drive more than 40 miles to get to their nearest pharmacy. So from Rangeley, you can either go to Kingfield, which is over where Sugarloaf is, or you got to go down to Farmington, which is the big city for them. They have a Walmart, Walgreens, and all of that down there. But I want you to hear from one of the residents here, because it really impacts if you have a child or if you're elderly, those critical medications you might need, you're either having to drive or turn to things like Facebook to try to see who's down in town and might be able to pick up that prescription for you.
You're like, okay, my child has something as simple as an ear infection, where now you have to put them in the car, drive 2 hours round trip just to get that medicine, because somebody might not be in Farmington that day, or you can't wait.
Yeah, I feel for parents, in this scenario. You have a child who is sick, and then you find out I now have to drive, all this way just to get them the medication they need.
I feel like we take it for granted down here in the greater Portland area, because it's like, okay, I have an ear infection or I need antibiotics for something. You call it in, normally within a couple of hours you can go down to Walgreens, go to the Hannaford, pick it right up. These folks really have to figure out and plan out how to get that medication. And you heard her, that if you go to Facebook and somebody's not there, you got to hop in the car and make sure you're heading down that way, which is difficult for people. That's a long drive, especially if you're up there and there's just a snowstorm, the roads may not be that great, all of that.
Yeah, and all they have is a small grocery store in Rangeley that they can get over-the-counter medicine, but pharmaceutical, a little different.
Exactly. They lost their only pharmacy 20 years ago. That IGA you're talking about, which is right by Saddleback, tried to open up another one, but it just wasn't viable. And that's the biggest issue here for independents and chains. It's not viable for them right now. There's these folks called pharmaceutical benefit managers, pharmacy benefit managers, and they're the middlemen that help negotiate prices and reimbursements between insurance companies and the drug manufacturers. And independent pharmacies say that's really squeezing them out here. They're not getting the money back to be able to operate the business that is essential to their community. We spoke with one of the pharmacies up in Jay. It's a small independent pharmacy, been around for 15 years. I want you to hear from him here real quick, because he kind of sums up what they're up against right now.
The bottom line is, if the money's not there for you to pay your staff, pay your bills, at the end of the day, a business closes. As much as we may hate that aspect of business, it's the truth of what we're up against.
And Dan, what are some solutions lawmakers are coming up with? I mean, this is not easy.
It's not easy, and there's a lot of facets here. It's the reimbursement issue. It's a more federal issue too. This isn't happening just in Maine. It's happening in rural communities across the country. But one creative thing that is being debated in Augusta this session is a bill that would allow remote dispensing sites for pharmaceuticals. So it would be things for acute medication. So your heart medication, nothing like a pain pill or an opioid or something like that. This would just be even things like for an ear infection, an antibiotic. But it would allow somebody like, say, a paramedic or a fire department to work with a registered pharmacy, go and collect maybe once a week pharmaceuticals and prescriptions for some people in that town, and they'd be able to dispense these to their community. So you wouldn't have to go to an actual pharmacy, you'd go to your town office or your fire department. That's a bill from Senator Farron, who's up in Somerset County. He has a lot of pharmacy deserts in his community, and it seems to have bipartisan support right now, so it's something we'll continue to follow.
Yeah, but right now it's almost like it takes a village. Everyone's kind of working together and try to help each other out, right? I mean, sometimes that's what you got to do. Your neighbors, neighborly things, right?
It brings you back to the fabric of our state, right? We make it work.
Yes.
But should we have to make that work is the big question.
I think it's easy to forget too, just because it's healthcare and it's, you know, people's, this might sound dramatic, but it's, you know, people's lives that we're talking about. But we kind of forget that it's a business, and there's a business part of it too. And, you know, people, you know, pharmacists can't just be losing money every day.
I mean, the pharmacist we talked to in Jay, he says they're almost taking a lot of prescriptions underwater. So they're trying to figure out creative ways to try and compete and get more people in the door so that they can continue to serve their community. So he, for instance, started to invest in a pill packaging machine where somebody can come down, say they have 5 prescriptions, they can come once a month and pick those up, and they're all individually wrapped and in a box, similar to some mail order systems like PillPack that Amazon does. And that was one thing I did hear from a lot of people. Why aren't people using mail services? We've done so many stories, the I-Team and the rest of our reporters, on how infrequent mail service is in rural Maine. So if you can't rely on the mail to bring you your prescription, you're at a dead end again. Yep. So it's just a revolving door here that it doesn't seem like there's going to be one solution. It's going to take a lot of things coming in from multiple angles to try and solve it.
And it used to be easy. I remember growing up, I mean, we're talking about the 70s and even early 80s, but when you called up and got a prescription, they used to deliver it to you for free. I remember a Volkswagen pulling up and delivering medicine right to our front steps, and it was included in your price. And so that was then, this is now. And we were in a small town too in California.
You think about even 30 years ago, each community had their own drugstore. You had a Rexall pharmacy or an Osco drug. That's what I grew up in my town. Those are just, they're not there anymore. And the chains, a lot of people thought they took over, but a big part of our research showed chain pharmacies are closing at almost the same rate as independent pharmacies right now. So the entire industry's in trouble. And
one more point, I mean, it also comes down to, does that closest pharmacy even have what you need? Because I went through this was just in South Portland, but I got sent to 3 different pharmacies for a medication for, you know, an eye issue I was dealing with, because the first 2 didn't even have it. So what if you're in Rangeley and the closest place doesn't even have the medication? You have to go even further to get it.
That's exactly right.
It's just a frustrating situation. I would be scared. I'd be on edge as a parent.
Yeah, and people are getting desperate. I'm sure a lot of people are paying extra money, like for DoorDash and things like that, to try to get their medicine delivered to them. But again, that's expensive.
It's expensive, and the service is probably not even available up in, say, a Rangeley. So it's great, you know, they've figured it out up there. There's a few people they know of in town who are frequently working in, say, Farmington, and they'll put out on Facebook the call that says, okay, I have this prescription for my son, I have this for my grandmother or something, and people will answer that call. But again, it takes time out of their day to go out and do that type of stuff, and it's critical access to medication that people should have a right to. And that's kind of the big debate. And here's what's going to happen moving forward.
Not everybody has a car.
Right.
A lot of seniors, a lot of you know, parents don't have a car either, so that's why this is a problem too. Think about all the seniors that can't drive up there.
So many factors.
We're the oldest state in the nation. This issue is only going to get worse.
All right. Well, you can watch the piece right now.
It's right on our website right now, along with Stephanie Grinley. We kind of tackled the desert of medical issues in our state. She looked at maternity wards. I looked at pharmacies. Feel free to go check them out. There's a lot of data in those stories.
All right.
WGMA.com and Fox23Maine.com.